Are there other signs that parents can look out for to see if their children are manifesting some sort of fear about food allergies in a different way? I am asking because I know a lot of adults who have OCD and they have food allergies, and sometimes they like to say that's probably because that was my coping mechanism as a child. So I'm just curious if there's something that parents can watch out for now and address early.
This is an important topic because this can happen in children with food allergies. So we want to just monitor. So, one, if they stop eating foods that they were previously eating without any concerns, that's a huge red flag. So, there's a reason for that. Maybe they ate something one time and their body felt a little different and they thought it was a reaction. Maybe they heard something or were told something and they're scared for whatever reason. So, if they stop eating things that they were eating, now you can have picky eating behaviors and certain taste preferences, but it should prompt the conversation. Why do you no longer eat this? Do you think it's going to make you sick? Bring it up with your allergist, that sort of thing. Children were reluctant to go to grandma and grandpa's. Sometimes it was because they were accidentally exposed to what they were allergic to, or sometimes something else happened and they didn't trust any other caregiver other than their own parents. So just kind of monitoring their behavior. It's very similar to signs of bullying in children. So if they start to withdraw, if they become more nervous, if they start to manifest with chronic abdominal pain or headaches, those are two of the most common symptoms that kids have when they're having increased stress or anxiety. And that can all kind of relate to one another.
Kortney, also OCD behaviors like lots of cleaning and things like that you alluded to would also be a red flag. If the kid all of a sudden won't eat until they've cleaned everything around them and are doing behaviors that a 5-year-old or 6-year-old normally wouldn't do, we want to definitely check those out and make sure that they're not feeling overly anxious about their diagnosis.